Those trees?
Yeah.
But the light was
But
also
the lights
out.
was out,
It
like
was.
clicking. Did you not stop? Did you just go?
It's like, oh,
Yes. All three of them were coming from Salinas, huh? Okay. You didn't wanna.
Yeah, here.
But it was back there too, coming this way.
Well, I was in Seaside, so I just came through the backside.
Oh,
Yeah.
that's what they should do.
So lunch was doing.
And they're the firm, huh?
We were talking.
They're the quorum.
Do I? Oh, yeah.
Is John your partner?
Oh, she's there. Yeah.
He knows your schedule.
You have quorum?
It's,
With her.
that's actually a surprise. Usually I'm the one
So we don't,
providing him
we'll
where he's
just,
supposed
we
to.
don't need them. Two. Who's missing? See? What's her name? I forgot her name. She's new, right?
Bella? No. Jessica's not
The new
here.
person. Like. The new one's really curly hair. It was here last week. Or last time. Talking about Elizabeth?
I have curly hair.
Blanca. Okay. Oh, she's with
Blanca
me.
is-
I mean, Transdev.
Yeah, yeah.
I think Kevin can provide an update.
Yes, Blanca, she went back to Georgia. She was just here on an interim basis, so.
Okay.
Yeah, so we've got Doug, he's in the crowd here, who's gonna provide the update for Transdev. And unfortunately, it's on the agenda, and somebody else, John, is on the agenda, but, that got switched after this went out, so apologies for that.
Jessica's not coming.
I don't know.
No, so Aaron and Thomas, they did confirm they're coming, but they're running late because I'm guessing they're going to Highway 68. Our chair and vice chair also confirmed that they are not able to participate today. But your bylaws calls for, if there is no chair and vice chair, to ask for a volunteer to take on the chair's role. We technically don't, I mean, we don't need a quorum at this point because our meeting hasn't started. We can go ahead and wait for Aaron and Thomas to arrive to make that decision or to ask for a volunteer to take on the chair role, or we can start it with whoever's here in the interest of your committee's meeting, which is that should start at 2. I'll leave that up to you to consider. Should we give Aaron and Thomas like another 5 minutes or so? Yeah. Okay.
You have quorum without them, or?
No quorum without
Cool.
that, so we can't
Only have the
even,
next item.
Where's Jessica? I know.
she's actually, she confirmed she won't be able to join today, so initially she mentioned she was gonna try and do Zoom, but.
Not here yet. Yeah, but you see it online. It shows the time.
I don't think we're streamed yet. I don't think it's
Or,
recorded.
as I say, did you want me to?
Well, I'm guessing we're not. I don't know. Are we? Just want to make sure.
It's been good, it's been busy.
Yeah,
It's been busy.
especially coming through the holiday.
Oh, my God. Yeah,
We are live? Okay, never mind. We'll have to remain quiet.
anonymous.
Yeah.
Nice one.
Welcome, Erin.
I imagine more of us are stuck in this sea traffic.
Yeah.
We're-
Yeah, let's go now. So I'm not going home that way. I'll follow you.
Do you know who's 208? 705? We don't have, we don't have a quorum, so if we are to do a roll call, we won't have a meeting. But Tom is a quorum. And he is stuck in traffic. Oh. Yeah. George is here, so we can, yeah.
Okay.
Hi, George. Oh, I know.
There's more people. That's why they're clapping, because they're like, I was really
I was looking down the window.
So, to start the meeting, the chair and vice chair did notify us that they're not gonna be able to participate in today's meeting. As mentioned, your bylaws does call for a volunteer to take on the role of a chair. So do we have a volunteer who would like to take on? Is that a yes? Okay.
All right.
And
Good.
all right, then, we'll go ahead and, start our meeting.
All right, I'd like to call the meeting to order. If we could take roll call.
The member Macias, not here, member Ramirez. Member Merritt,
Present.
member Gross,
Present.
member McKillop. Member Fuller Kuda,
Present.
member Garcia,
She's
Leticia?
joining BSC.
All right.
wrong one.
Stay here.
Leticia, are you present?
Stay here.
There, Mike.
Oh, there's a wave. Yeah. You wave.
She's muted, so.
She's muted.
There
There you go.
Did you guys hear me?
Now I hear.
I'm not just a poster, I'm moving.
Oh, so weird.
I'm here.
Yeah. Right? That good?
Actually, I just for transparency, because Leticia is joining us,
It doesn't count towards quorum.
she does,
She does?
she does. She is joining us through just an emergency cause for today.
Okay.
So she does, yeah, she will be part of the quorum and a
Great.
voting member.
Yay.
Okay, member Gandara,
Present?
member Luis, Present. member De La Cruz. Member Hernandez. Present.
Great. That constitutes a quorum. Very good. Right, let's move on to item 1.2. Are there any guests in the audience that would like to introduce themselves? Seeing none, we'll move on to public comments. Does anyone have any public comments? Not on our agenda. All right, seeing none, we'll move to the consent agenda. I'd like to approve the minutes of September 24th. Everyone had a chance to take a look.
I move to approve the minutes of the regular meeting. September 24th.
I do apologize. I should have mentioned it before asking for a vote. There is a typo on item 4-2.2. It should be corrected from member Macias to Merritt. Just to make that correction. Okay.
We approve the consent agenda with the corrections.
A second.
Hi.
So we do have a motion, we have a second, since we have member Leticia, we assume we have to do a roll call vote.
All right,
So I'll just go ahead and first, the member Macias, there, member Ramirez, member Merritt,
yes,
member Gross, member McKillop, member Fuller Kuda,
Approved.
member Garcia, member Garcia.
Gotta get off. You need to turn on your mic and say approved. Or not approved.
Approve.
Member Gambetta,
Yes.
member Luis,
Yes.
member De La Cruz,
Approved.
and member Hernandez.
Yes.
Thank you. All right. So we'll move on to new business, for one. We'll review, discuss and approve the MAC meeting schedule for 2026. Any discussion?
I do. No, I do have a question.
Yeah.
For the final meeting in November, it says that it's scheduled on a mandatory closure day. Can that be advanced 1 week to the 18th?
Um, I'll provide you an initial response. The answer is yes, it can, but the committee will have to approve that. So if, for like similar to our meeting today, this is, or would have been the following or the last Wednesday of this month. But when we approved the agenda, the schedule in the beginning of the year, we moved it a week earlier. So if the committee agrees, then yeah, we can definitely do it.
Motion?
I would motion to move it to Wednesday, November 18th, 2026.
I second that.
The motion and the second. To Steve.
Do you wanna vote?
Yeah.
Roll call vote? Okay. So member Macias. Member Ramirez. Member Merritt,
Aye.
member Groves,
Aye.
member McKillop. Member Fuller Kuda,
Aye.
member Garcia,
Aye.
member Gambetta,
Aye.
member Goiz,
Aye.
member De La Cruz,
Approved.
member Hernandez.
Yes.
The schedule.
Thank you. Moving on to 4.2. Receive an update on the requirements of Assembly Bill 1250 for ADA paratransit eligibility and recertification. Christie?
Good afternoon, everyone. MAC members, MSD staff, and members of the public. Again, I'm Christy Sugabo, Mobility Services Manager. Before I do provide the update, I just want to share that we have been notified by IT that we will continue to see the screens go black every so often. So just a heads up on that. With your agenda packet is a memo to receive an update on the requirements of the Assembly Bill 1250 for the ADA paratransit eligibility recertification. Your committee provides a mechanism for communicating concerns, advice, and recommendation between those who rely on MST for their ADA paratransit needs, specialized social services transportation, and the MST Board of Directors. So approved by the governor, filed on October 13 of this year, Assembly Bill 1250 mandates that starting June 2027, transit operators implement a streamlined recertification process for individuals previously determined eligible for ADA paratransit services. The streamlined recertification process must utilize one of the following methods: telephone interview, mail-in forms, or an online survey. It may only collect the following information: physical address, mailing address if different from the physical one, emergency contact, phone number, updated mobility devices, status of disability with identification of any worsening of the person's disability, any additional disability, any changes to the person's functional abilities, and any changes to the person who used an assistive device. So MST's current recertification process, which includes a telephone interview, does meet one of the approved streamlined methods, but modification to the information collection process is needed in order to align with the new information collection requirement. So starting in the coming year, I will be working with my team members to discuss a transition plan for the new requirement. And that's about my update on that, but I'll be happy to answer any questions you may have.
Anyone have any questions? So currently, are you collecting all the data that was in here now or no?
We are, but our current process requires recertification, eligibility, the initial collection of those information is similar to that of someone who is new to applying into the program.
So they have to recertify their eligibility.
Yeah, so we have to make some changes on how the initial part of that process is going to be. So that it's not similar to that of somebody who is new to the program. Mhm.
Thank you. Any other questions? Thank you, Christine.
Okay, thank you.
Right, we'll move on to 4.3. Measure at Senior and Disabled Transportation Program. We need to appoint a member to serve on the Senior and Disabled Transportation Grant Review Committee. Aaron.
Yep. So for fellow committee last time we met, I gave presentation on the Measure X Senior Disabled Program and announced that the Cycle 4 call for projects was opening. So it had opened since October 30th. For Cycle 4, which will cover 3 years of funding for starting fiscal year 26-27 through 28-29. And as part of this review process, so once we get the application submitted, we have a grant committee that reviews these applications and conducts site field visits with the most competitive applicants. So we basically have been gathering this grant review committee, and the grant review committee will compose of TAMC staff, Measure X Assistance Oversight Committee members, and a member from this committee. So far we've received appointment from 2 members of the Measure X Oversight Committee. And for this committee, as part of the program guidelines requirements, we asked for at least 1 member of this committee to participate in that grant review committee. In terms of time commitment for that grant review committee, so once applications are received in December 18th, staff will do an assessment to ensure completeness of the applications. And then throughout the latter half into December into early January, the committee committee members will individually score these applications, and then we'll convene as a group to identify which ones are the most competitive of the applications, so that we can schedule site field visits for interview questions later into January. So it is kind of going to the holidays, so for this timeline, I did want to give a bit of buffer for folks in the committee to give a chance to review the applications, because it's into the holidays and then in the beginning of the year. So yeah, it's a good learning experience to get familiar with a lot of the work that's done in the senior disabled transportation community, and really get to know of the services that are out there as well. So it's a good learning experience as well. So that kind of leaves my report, and then for our takeaways, pretty much just identifying who from this committee would like to serve in that review committee.
And how many proposals do you normally receive?
So historically, we've gotten a fair number of 5 proposals.
Oh, that's
Yeah, so we did host a workshop earlier on November 6th for prospective applicants, and there was a pretty good attendance from potential new applications. So it may be just, maybe a little more, than I anticipate.
So is there anyone willing to volunteer?
Since I work in contracts, and I'm new, I'll go ahead and do it.
Very
I'll
nice.
volunteer to do it.
Great.
Easy. Yes, I guess the one thing, well, just to mention is, if any of, because I know some committee members here are in those organizations that typically submit an application, so that would be the only conflict of interest, so, but in this case, I think there's no conflict of interest.
Chair, this is an action item because it's for membership representation.
Very good.
If you can go ahead and do.
Oh, I move that Tom De La Cruz be appointed to the Measure X committee.
I second it.
Third, fourth, fifth, yeah.
So we have a motion, we have a second, so we're gonna do a roll call vote. Member Macias. Member Ramirez. Member Merritt,
Aye.
member Groves.
Okay.
Member McKillop. Member Fuller Kuda,
Aye.
member Garcia.
Off the
It's up the
speaker.
high
So
side.
we'll come back to that one. Member Gandara,
Aye.
member Ruiz,
Okay.
member De La Cruz,
Okay, she's off microphone.
Get off microphone.
member Garcia.
Aye.
There you go.
There we go.
Aye.
I have you on the phone too. That's why I can hear the echo. Oh. So there's no sound on my Zoom using my computer. So I have you on the phone as well.
Wow, that's an actual telephone.
Wow.
So member De La Cruz
Aye.
and member Hernandez.
Yes.
Motion passes.
Thank you. All right, we'll move on to presentations. 5.1. Receive an update on the Salinas Rapid Bus and Transit Center relocation. Emma Patel.
Good afternoon, members of the committee. I am Emma Patel, Planning Manager. Last summer, MST was awarded the Caltrans Sustainable Planning Grant to study the East Alisal BRT and STC relocation study. Additionally, we received local matches from the city of Salinas and Taylor Farms. Next slide, please. Today, I'll go over the project objectives, the schedule, and outreach. Next slide, please. So there are two main objectives for this project. The first is identifying strategies to enhance transit speed, reliability, and ridership along the East Alisal corridor. And the second is assessing the feasibility of relocating the Salinas Transit Center to better serve the East Alisal community. Next slide, please. So the project goals play into the community needs as well as MST's regional vision. Our passengers rely on the bus to get them to work, to school, and to get around in their daily lives. So providing reliable transit is imperative. And one way to achieve this is through bus rapid transit. During the Better Bus Network outreach, the community overwhelmingly shared that they would prefer more fast and reliable service to key destinations. MST's regional vision involves BRT throughout the county, and this BRT project would enhance connections to the SURF BRT, which is currently in progress. Next slide, please. So the study area extends from the East Alisal corridor at Homestead all the way up to Williams and Barden. East Alisal is the key east-west connector in Salinas, connecting residents from their homes to their jobs. This corridor currently serves lines 41, 42, and 47, and this is some of our highest ridership. MST is the single largest user of this corridor with about 110 daily trips. Next slide, please. So although this is the highest corridor for ridership for MST, this corridor also has some of our lowest on-time performance because of the congestion, which you can see here. Next slide, please. Here you can see some of the highest ridership stops along this corridor. The top 10 stops all have over 50 boardings per day. Next slide, please. The second objective of this study is to study the feasibility of relocating STC. Currently, STC has 9 gates and we have 19 routes serving these gates, so we're at capacity. The city of Salinas is also interested in redeveloping this area, so they've asked us to look at additional sites. We're looking at 5 potential sites for relocating the Salinas Transit Center. Next slide, please. So we kicked off the project earlier this summer and we've had the first of 4 TAC meetings. We're currently in the first round of outreach. There are going to be 3 outreach rounds, and the third round will end around fall 2026. This project is expected to end in fall 2026 when we bring the final plan to the board for approval. Next slide, please. Because of the high ridership along Alisal, this project has the potential to impact a lot of residents. So public outreach is a big part of this project. We're breaking it out into 3 phases. The first phase will focus on collecting input on the project goals and understanding existing challenges. We've started outreach for this phase. We've been to local events. We've had some tabling at the Salinas Transit Center, and we'll be doing outreach at local apartment complexes. Phase 2 will focus on collecting input on the corridor concept designs and evaluation results. And some of the activities for this will include community meetings and online surveys. The third round of outreach will focus on sharing and collecting input on the final draft plan. Next slide, please. So we have a survey out right now that's open for a couple of more weeks. We're collecting feedback from transit riders as well as non-riders to get their feedback on what they'd like to see along the corridor and as well as what they'd like to see at the new Salinas Transit Center. Next slide, please. So the next steps are going to be to review the outreach findings from round 1. We'll be holding focus group meetings coming up in the next couple of months. And we're going to be identifying potential sites for the STC relocation and identifying improvement alternatives along the corridor. Next slide, please. That concludes my presentation. I can answer any questions.
As part of the outreach, are you going to senior housing complexes and the senior and community centers?
Those are not specifically on our list, but it is something that we can talk about.
Any other questions? Thank you.
Thank you.
Great, we'll move on to 5.2. And we'll receive a presentation on public health programs and services through the County of Monterey's Health Department. Elizabeth Gandara.
Yeah.
Thank you.
Can I do my presentation from here? Yes.
Fine, but you can't move the mic.
Oh, sorry about that. Oh, do not touch, move the microphone. All right, can everyone hear me? Yeah. Cool. So my name is Liz or Elizabeth, and for those of you on Zoom, my role is a health program coordinator with specifically working with communicable disease prevention and control. So I get to work with folks who support community members in treating conditions like syphilis, chlamydia, gonorrhea, HIV, any communicable disease that you could potentially think of that is under Title 17. So that also includes valley fever, the flu, and we do a lot of outreach around the winter for vaccine clinics and things of that nature. So I'll be talking a little bit more heavily about that, but the Public Health Bureau is massive. The health department itself is huge. So this is just next slide, please. This is just a depiction. Next slide. Okay, thank you. This is just a depiction. This is not for you to have to look through everything, all the small text here. This is just a picture of what the health department organizational structure looks like. I am part of the Public Health Bureau, which is the one that has a star. There you will also see environmental health up at the top, Emergency Medical Service Agency, the Administration Bureau, amongst many other bureaus. And so Elsa Jimenez, who you might all be acquainted to, is our health department director, and Edward Moreno is our medical officer. So if you can, or health officer, if you can go to the next slide, please. For today, I'm only focusing on a few areas, divisions, programs as part of the Public Health Bureau, because as you can tell, we're also huge, even though we're just one of the bureaus in the health department. Public health is, I believe, over 150 individuals, nurses, community service aides, office assistants, and a lot of other registered dietitians, a lot of other folks who work as part of these many groups on here. So I'm going to be focusing on communicable disease, which is what I focus on, health promotion and disease prevention division, public health field nursing, and the sexual assault response team. Next slide, please. So communicable disease prevention and control. As I mentioned, I particularly focus on HIV and I support with STI programs. However, I'm a part of a larger group called Communicable Disease Prevention and Control, and that encompasses all these little smaller groups or programs. Communicable Disease Unit really focuses on the list of reportable diseases with the exception of tuberculosis and HIV. So those have their own different programs or groups. And so there you could see a list of all those reportable diseases. We get a lot of calls from like senior centers, schools, different groups that want to report, like right now, hand, foot, and mouth disease is huge. We'll get like flu, COVID, and then we have, to a lesser extent, chlamydia and all those other ones. Chlamydia only gets reported to us, or we work on those cases if the individual is pregnant, because it's more high risk. And so for the rest of them, we do end up calling patients, making sure that they're linked to care, making sure that they know that doctors also have an understanding of what the treatment regimen is. For syphilis, that is a very complicated one, and it was on the rise, but it looks like it's getting better. And someone who has syphilis will test positive even if they've been treated, or will test reactive. And so it's important for medical doctors to reach out to public health to make sure that it's not a reinfection and things of that nature. So science, very complex stuff. But that's what we're there to do. We're there to answer anyone's phone calls regarding questions related to all these reportable diseases or infections. HIV programs. So I lead that, and I brought a few things for folks to look at, but I'm not going to pass it around, but just going to kind of show it here. Something we're launching is take-home tests. So this people are going to be able to request an at-home test if they don't have insurance and they just want to know what their status is, or they were told by a partner that they have that they've been potentially exposed to something. Then they can go ahead and request one for free. And this one they sent over to a lab and a test for chlamydia, gonorrhea, and trich. Additionally, we have syphilis at-home tests that people can also grab at the health department. And I also have HIV tests in our office. That's in lieu of people being able to access health testing through a lab because of lack of access to health insurance, or they're afraid that their parents are going to find out that they're getting tested or that they've tested reactive for something. So that's HIV and STI programs. I also lead the condom distribution program for the county. Any organization can request to have condoms out of their organization. This is free, and it's from the Office of AIDS Clearinghouse. If Home Depot wanted to request condoms to distribute out of dispensers in their bathrooms, that would be allowable too, as long as they said, we want to create access and prevention of HIV and STIs to our community. So anyone really can apply, so long as they indicate an interest to prevent and reduce rate of HIV and STIs. And that is through our website. As long as you Google condom distribution program Monterey County, you can find our form, or you can always ask me and I will help you through the process. Tuberculosis, we also have a tuberculosis team that actually goes to people's homes to provide their directly observed therapy. So they observe and help support someone in taking their medication. It is I believe it is a multiple week don't quote me on that, multiple week month treatment. So it can be pretty intensive, but it is definitely very beneficial. And our nurses and community service aides go out into their homes to make sure that they get the medication they need. They also provide community health education on latent tuberculosis, which is when someone has tuberculosis, but they're not experiencing symptoms, therefore they're not contagious, but they still need treatment. The EPI team is our outreach and surveillance team, and like for instance, we had a lot of valley fever recently. It's been one of the highest in the past few years. So South County is at greater risk for valley fever than other parts of Monterey County, but definitely anyone can get it. It's a fungus in the soil. So we were out making phone calls. Our EPI team was out making phone calls, making sure that individuals who had tested for cocci or valley fever were getting the linked to care or getting connected to an infectious disease specialist, or that their doctors were aware of the treatment regimen if it was necessary. Lastly, we have our immunization program, and that is really pop-ups. Anyone can reach out to them and say, hey, we have a group of people that want vaccines for the flu, for this, and you can go ahead and reach out, and hopefully we can set something up and provide those to that facility or that organization. And so we've been doing a lot of them. From what I've heard from my supervisor in the past meeting was that they still have some vaccines for the rest of the year. So if anyone wants to do a pop-up at their facility, that is, please contact us and we can, or him, and we can get that hopefully scheduled. Next slide. This is a way that folks can sign up for health alerts. So if there's ever any questions in regards to that, in regards to what, how can I find out when there's something that can impact my health or et cetera, this is a good way to do it. I just signed up for it for the first time when I learned about it. So I haven't gotten anything yet, but really we were the COVID team. The Public Health Bureau Communicable Disease Prevention and Control was the COVID team during COVID, during the outbreak. And they really were the ones communicating with the public, making sure that the pop-up vaccine clinics were available when the vaccine became available, and just doing all that. So this was widely utilized. Next slide, please. Enhanced care management. I'm just going to go over this very briefly. Do we still have time? Yes. This benefit is through Central Coast Alliance for Health, and it is for individuals who have a variety of different needs related to experiencing homelessness. They're going to the emergency room because they have a higher level of care that they need, and they don't understand what may be going on. Folks who have mental health and substance use disorders, though these are some of the ways that they'd be able to qualify or eligibility qualifications for this program. It's really great. These case managers are public health nurses, and they really support with linking to so many different services. Some of the things that they help with, for example, are finding doctors and specialists for their various needs, scheduling appointments for health-related services. You wouldn't know how hard, I mean, you probably do actually. It's hard enough to manage our appointments, let alone the appointments of someone who might have more chronic health issues. It is hard to find appointments. Sometimes it's hard to find a specialist. It's hard enough as it is, let alone for someone who might be experiencing mental health or substance use related issues, or just for our aging community who just have such a hard time navigating systems that are really complex. They also set up the RIDE program through Central Coast Alliance. So that's really wonderful because it helps a a lot of our patients be able to get to their appointments. Sometimes it can be hard getting them onto the program itself, but once they've got the hang of how to use it, it becomes easier. They can help them through that process of figuring out how to make that call and type up all those 10 different phone numbers or extensions that they need to get access to that program. They also help them through find community-based programs or services that they might need, nutritious food and aftercare from when they leave the hospital. It's a great program. Next slide, please. And then chronic disease and injury prevention. This one, I did want to make some clarification that the screening sheets and the workshops are separate. They do provide presentations. It's more like presentations on healthy aging, how to continue to stimulate your brain after you've reached, after you progress with age, how to, and then they can physically come in. Someone from Healthy Aging can come in to do the screenings. So these can take up to 5 minutes, and really it's just more of an assessment that someone could do once a year to just check and see what they might need to focus on with memory related things such as medication and things like that. You might be acquainted with them already. Her name is Diana, and this is also Jairo is her supervisor. So you might know Jairo if you've worked with Healthy Aging through the county health department. They also have a program called Bingo Side and Bingo Size. I'm so sorry. That was a typo that I wanted to fix, but I wasn't able to do so. So Bingo Size is a sort of a fun twist on bingo, and through the program itself, they go ahead and they incorporate physical activity components that are accessible to all different abilities, and they also incorporate like little health education on how to take care of ourselves as we age, or how to just take care of our daily health, mental health, physical health, emotional health. So it's a really cool program. Right now, they're at 2 different areas. It's an 8-week program, but they're looking to expand it to 10 weeks. And after they're done with these facilities, and they'll move on to another. But it's a really great program in case you're interested in bringing it over to your agencies. You can contact Diana at healthyaging@countyofmonterey.gov. Next slide. I think, wait, is that it? Oh, sexual assault response team. So I will just go through this really quickly as well. But this is not Monterey County Rape Crisis Center. And this is through the county. However, they collaborate very closely with Monterey County Rape Crisis Center. And the sexual assault response team is a collaborative group that is composed of different stakeholders, such as law enforcement, the district attorney's office, and advocates like Monterey County Rape Crisis Center. They come together to support victims and survivors of sexual assault. And so there's different ways that folks can report. They can do a standard report, which would be contacting law enforcement directly at 911 to report a sexual assault or child abuse. And then second, it's a non-investigative sexual assault forensic examination. So they do this out of Natividad Hospital or Medical Center, and it's an option for those who wish to have a medical examination for evidence collection, but don't necessarily are ready to report to a law enforcement agency for a variety of reasons. And so that doesn't mean that someone can't report later down to law enforcement, but it just means I'm not ready yet, and I don't want law enforcement there during my examination or during that process. So 2 different ways to go about accessing help and support for survivors. And then the information for contacting them is down below, but it is the 24-hour helpline, which is 831-375-HELP. And we have one person who is our coordinator. Her name is Faye, and she's really great. In case any of you ever want to get connected to someone who works in any of these different groups, just reach out to me and I will make sure that you have their contact information. There's so many other different agencies that I work with, or groups, programs, and divisions. So if you ever just have questions about how to get connected to someone, I can, even if I don't know them, I will go ahead and ask around and find out who that person is. But that basically, that's the end of my presentation. Let me know if you have any questions. That was a lot of information.
A lot.
Get a big job.
Anyone have any questions for you, Elizabeth?
No, our Castroville nutrition site is also a licensed bingo size site and they love it. I think they've got 2 sessions a week there. It's so popular. So
Yay, wow.
It's a good program.
I'm excited to learn about it. Like whenever you incorporate bingo into something, it's fun and very meaningful that, you know, they could have fun with it and learn.
Thank you. All right. So we'll move on to reports and information items. 6.1 MST ride service update. John?
Well, I'm Doug, and
Okay.
I'm
Hi, how are you?
hi, good morning,
All
sir.
right.
I am sitting in for John Hune. I'm the interim general manager, Doug Geese. I left TransDev in April and I came back as a contract employee for a few weeks to help out with some projects. So I've been on site 2 or 3 days, but long enough to kind of get a sense of what's going on. I've spent some a couple phone calls with Kevin, and I spent a lot of time around the team. So briefly, I want to go through the slide deck, which is going to give you an update of our service delivery right now and where we're at. And I'll talk a little bit about some issues that I see that we're working on, and then also be ready to answer any questions. With me is Robert Brown. He's our maintenance manager, and David Cox, who's our AGM. Most of you know David. He's been around a long time. So with that, good afternoon. So I don't know who's running the.
Just say next slide.
Oh, next slide.
Yeah.
Safety is at the forefront of what we do. We're going to see a slide here in a minute. It's going to talk about our safety numbers and how we're doing. But I think generally my take on the safety program and what's going on, we generally have a really safe team. I'm really proud of that. Next slide, please. This is total AFR year to date and month, and so we started in July, and the cumulative AFR. But as you see, we started in July, we went down for a couple months, and then just because of the amount of miles that we operate, one event can cause it to look like it's really spiked up, but it really hasn't spiked up. We're at 0.36. Anything in our industry below 0.75, 1.0 is going to be considered really good. So I'm very proud of the team. Obviously, we want to shoot for 0 incidents, but I think we're on the track to have a good safety program at our location. Next slide. So again, this shows you, this is the preventable AFR, and the one incident that we had in October, I think is good, skews what looks like it turns it into a bad month. But we had 0 for the first 0 preventables for the first 3 months, and then in October we had an event, so it's going to look like that. The previous slide was preventable and non-preventable. Next slide, please. So I'm not going to spend a lot of time about this because there's really a lot to digest, but members of the committee, as you look through the slide deck, you'll see this slide and the next slide talks about trips for purpose and where we're taking people, what types of services we're getting people to, obviously the education, training, and daycare, as well as a personal recreational are our 2 biggest. Total for the period was 7,091. Next slide. And this is the trips provided by Yellow Cab, 3,376. So total around, we'll get to that in a minute, but total around 10 or 11,000 trips for the period. Next slide, please. This is going to show you the last 3 years, the growth and or how ridership is moving. If you look at the bottom slide, which is total rides and total passengers, you can see here that for the month of October, for the last 3 years, September and October have continued to move up. Same thing with August. We had a little bit of a dip here in July, but August, September, and October, all 3 years has been a steady incline of more trips and more rides taken. Next slide, please. This is a big one. This is one that we spent a lot of time focusing on. This on-time performance in conjunction with passengers per hour is really, other than safety, the key component in grades that we look at and our clients look at. First month, July, we had a struggle. We were a little bit under 90%, as you can see. Ticked up quite a bit to 92% in August. A little bit of a dip September, about 91%. Last month, 92.88. I think this month so far we're around 92% for the month to date. Today, when I left the office, we were at 100% trips for today. We made some tweaks. I was going to talk to Kevin afterwards about this, but we made some tweaks in the office yesterday and the day before, trying to work on improving the service. We have a couple other things. I'll try to keep it really short, but a couple other things we're working on. We'll talk about headcount in a little bit, but components that are going to help us really be good on-time performance are going to be making sure we have enough headcount. We can get enough service on the road to be able to deliver good on-time performance for folks. The second thing is what we call a run cut, which is a distribution of the work to the work hours. And we're in the process of having a final run cut done by our corporate staff, which is going to help us distribute the work more evenly to the peak service hours. And so that should be done. And I would say by the middle of December, we should have that new run cut in place, which is really going to help us. And what it's going to allow is going to allow us to, like, I'll give you an example. Yesterday, the team was pointing out that we have 4 or 5 trips in the 5:30 to 7 o'clock hour, but we don't have the manpower or horsepower coming in to get people picked up. So one way to do that is call people and have them come in early, which we have done. However, according to our union contract, we can only call them in an hour. So we still have problems. So we're working around that. I think today's going to be a really, really good day. And I think the things that the team has put in place are going to allow us to move forward. The passengers per hour is another important component, and the passenger per hour is about 1.55 for last month, and it's kind of a fine balance, right? I mean, we could provide 100% on-time service, but your passenger per hour is going to be about 1.3, which means you're spending a lot of money for service that you don't need to. So it's a balance between on-time performance and PPH, and I think what we're really focused on right now is stabilizing the service, getting enough operators, getting the passenger or getting the on-time performance where it needs to be, and then we can dial the passenger per hour up where you as a committee and the agency are going to be happy with those numbers. Next slide, please. There's a lot to digest here. I'm not going to spend a lot of time on this slide. It just shows on-time performance by the time of day and then the number of trips per hour. And again, that's another thing that we talked about as a team. I'll give you an example. At 1 o'clock today, we had 62 trips scheduled. At noon, we had 10 trips scheduled. And at 2 o'clock, we had like 12 trips scheduled. So we have this 1 o'clock hour, we have all these trips. So there's some things we can do to try to smooth out the service day. And we'll work with the agency and make sure that we're doing right by the passengers. You know, basically it's negotiating trips so we can move people to the hour before and hour after, only with their approval, only with negotiation, and only through the right process. But those are things that are going to help with long-term, on-time performance that we're looking at. Next slide, please. Complaints. Well, looking at this slide may give a sorry.
It's so hard.
I'm struggling to talk, but well, there you go. So of course, right when I walk away, you look at the slide, you would look at this and you say all complaints are down, but in reality, this is an inverse slide, which means that the farther away from zero, that's more trips taken per valid complaint. So August was really good, 5,000. We dipped down a little bit and then we're down here. So we're having more complaints than we'd like. And it's our commitment to this committee and to the passengers and to to the agency that we're working diligently to try to get our customer complaints reined in and get those reduced. Few things going on, again, too much information. I don't want to try to digest it all, but new company, new routes, readjusting things, and we're in the process of getting that all smoothed out and getting that all moving in the right direction so that we can get that complaint number again much further away from zero than it is right now. And that's certainly something other than the on-time performance and the new run cut and the new redistribution of work. The complaints is one of the biggest areas that we're working on for the agency and for you all. Next slide, please. Complaints by type. I won't really get into this a lot. You can look at this. If there's any questions, feel free to shoot me a note or go through Kevin and get me a note. But it just explains our complaints by type, whether it's pass by or.
What does pass by mean?
That's more of a fixed route complaint where you're waiting at the stop and we go
Zoom on by.
Yeah. Yeah. And so a lot of the complaints that we've had, we juggled our fixed route. Again, I know this might not apply here, but we juggled our fixed route to accommodate the state law for meal and rest breaks. And because of that, we have drivers that are moving around in different buses on a daily basis versus getting in one bus and staying. So because they're doing different routes, it might be unfamiliar. So again, part of this new run cut is to try to bring that back to center and get everybody on the same route every day versus switching buses. So I expect to see the complaints on both services come down in the next couple months to where they should be. Next slide. Again, to your point, ma'am, fixed route, 57% of the complaints, paratransit 38% or 39%, and then taxi was 4%. So, you know, if we can get complaints moving in the right direction, I'm going to feel really good about where we're at as a service, especially since I feel strongly that on-time performance is going to be where we all want it very soon. Next slide. Again, fixed route complaints by route, the 191, that happened. I was told when we moved facilities and moved into our new facility, there wasn't enough time built into that had to get to the first pickup. So a lot of complaints regarding that. But again, these are going to all move in the right direction. And they are right now. Next slide, please. So PMIs, one of the most important things that the shop is gauged on or judged on. And you can see when we first took over in July, we had 4 late PMIs. In August, we had 1, in September 1, and then in October we had 0. And Robert, so far this month, sitting on 0. So there's going to be a slide in a minute where we talk about our staffing, and we're fully staffed. We have everybody integrated into the TransDev way of doing business. Robert was not a TransDev employee when we took over, but is now. Obviously, he's part of the family, and he's got the shop moving in the right direction. And again, zero PMIs. Why is that important? Your assets cost a lot of money. We're in charge with taking care of your assets. And in addition to the fact that we need to take care of them, we need to have them safe and make sure that they're good to go on the road. So I believe we've got this on track as well. Next slide, please. Recruitment and headcount. So this is a big thing. We took over. We were short some bus operators and other staff, and I'll go through that in a minute. Next slide, please. So again, too much information, the number of applications that we received, number that we interviewed, offers that were made, and then the number of people that were hired. So you can see we do churn through a lot of people. It's I think fairly common in all industries now. You churn through a lot of people trying to find the right ones. It was interesting. A little sidebar. I met somebody yesterday. She's been with us 8 years, and she's number 34 on the seniority list. So, you know, when you can get people like the young lady that I met who's been with us 8 years, and we can get them to stay for a year, we can get them to really get to really feel like they're doing something special with this service, we can get them to stay and we can get them to be a part of what's a really good program. So we do make being fully staffed a big priority for our company and for the location. And again, the on-time performance and the service delivery is going to really reflect being fully staffed. Next slide, please. Interview versus applicant. I'm going to skip over this. If you have any questions, you can let me know. Next slide, please. So here's the org chart. General manager, and I talk to Carmen almost every other day or so. Carmen's the senior vice president for the region, and Carmen and I have had a good relationship for a long time. John is the regional director of operations that works for Carmen, and I know they're working hard trying to find somebody. I know that isn't what y'all want to hear. You want me to tell you that we found somebody, but I know it's a big priority for our company, and I know it's really important to us, and as well as the agency and as well as this committee, that we get fully staffed in that position. That's a key position. So I'm committing to you that we are truly working really hard as a company trying to find that position and that person, whoever they are, to get them into place and get them seated and trained up. Just real quick here, we have one clerk opening that we have somebody in process of going through the pre-employment process, so that position's essentially filled. And then we have one utility worker that we're actively recruiting for. Our drivers, we have 77 trained operators active, and we have 71 bids. I think this new bid shift's gonna jump up to about 78. So we do have 4 or 5 people in training now that'll be coming out, and we're gonna have another class start either the end of November or early December, which again, keep the flow going, keep the pipeline full, and keep our driver positions where they should be. Why is that important? Burnout, fatigue, safety, holidays. People want to take holiday time off, but when you're not fully staffed and they have to work a ton, it's really hard on people. So, but I'm happy to say that I believe we're fully staffed on operators, and this new run cut is going to add a few positions, but I think we're in a position to fill those right away. Next slide. This next slide, I'm not going to go through it a lot, but to tell you that Transdev, they call it Transdev University. It's an online training modules that are available to our team. This is only but a brief blip of the hundreds of different classes that people can take. And these are the items or classes or things that our team has been and will be working on. In addition, we have a great relationship with Ecolane, and which is the software we use for scheduling. And we have somebody on our corporate support team that's an expert in Ecolane who's going to continue to provide support. We're going to give some extra help to the team to make sure that we're utilizing Ecolane, moving trips around as efficiently as we can, and that we're utilizing the software as it should be. But again, I won't go into this other than to say there's a lot of resources available online and otherwise for the team, so we can make sure that they're trained up and ready to deliver the service that we need. Next slide. Staff development initiatives that goes along with the previous slide. Customer service, training by Kayla Daniels. We have Stan RTA person. Stan RTA down at Modesto is a Ecolane service as well, and we've had somebody come up, and we can continue to lean on that resource if we need to. We're going to continue to focus on customer service, and then training up the supervisors and the team. I'll give you just one brief example. I don't want to take up all your time. Why is it important for the supervisors to be trained up? Getting the drivers off the lot on time is one of the most important things that we can do. And so working with the supervisors so they can jump in and help with service delivery if there's an issue, help the drivers if there's a problem, if there's a service delay because of an unruly passenger or a passenger that's sick or something like that. So we have a lot of things that we're working on. 4 months in, I again, been around the industry 40 years, and 4 months in, I see a lot of really, really good things going on, but we're not happy with everything. We need to certainly improve and move things forward. From my perspective, you run cut, on-time performance, customer service, and then the complaints and customer service. I mean, I really, we need to really focus on that. Next slide, please. Safety initiatives, again, won't go through this a lot, but I know Kelly, the safety manager, because I worked with her when I was in Southern California, and I know her commitment and dedication to the safety program. So we ask each location to develop, and I haven't asked Kelly yet to see hers, but we ask each location to develop a robust, intensive safety plan for each location. It's different for each one. It depends on the kinds of incidents that each location's having. But we have Lytics, which is our drive cam program, coaching, retraining. We have defensive driving contest, which is going to focus on winter weather awareness, and then we're going to have we talked about a little bit about, we're new here, changing the negative bias. And I don't want to call it negative bias as much as different company bias or different leadership bias. And I see that in the industry in the last 40 years. Every time a new company takes over, it's always kind of like the bias, meaning the fear of the unknown, we didn't do it that way before. And so I think it's important that we continue to push forward and try to get everybody to feel comfortable about being a TransDev employee. Like I said, been here since last Friday. Everybody that I've met has been as polite and friendly and courteous and kind and welcoming as you can possibly, which tells me, I can walk in a building and in 5 minutes to know if there's a bad mojo there, and there is not here. People are certainly, and you can tell by the safety program that's reflected too. You have one preventable incident in 4 months. People care about what they do, they care about the company, and they care about their passengers, and we can certainly see that. Next slide. We had I wasn't here, so I don't know what we did, but we had a 5 days to Halloween countdown, kind of a celebration, get the team, again, more team building, getting people feeling good about work. And then we had a Halloween safety blitz. Next slide. And these are every person that's Kelly on the right. So based on that look, I'm not going to have an accident. But what's important and what we really strive for in our company is that every single person that's trained to be a driver, whether it's classroom, BTW, and then the revenue or in-service cadet training, is trained by a certified instructor. And these are 6 folks who have been trained by our company to be trainers. It's important that we train the same way. Everybody gets the same messaging. The files are complete, and it's all done properly. So that's our behind the wheel training crew, led by Kelly on the right. Next slide. And then again, engagement initiatives. It looks like I wasn't here, but it looks like we've had some potlucks. We've had some different things to work on building the team. So I think that's the last slide. Next slide. Any questions for me? Yes.
Hi.
Hi.
We're Ina from Alliance on Aging, and I go all over Monterey County, provide services for our seniors. And a lot of our seniors, since 2 years ago, are not happy with the new stops. So my question to you is, how's South County coming along with all your reports? What complaints have you had from South County? New ideas for South County and their bus stops? I had done not a complaint, but 2 months ago regarding seniors, walking 4 blocks to their bus stop when it used to be just right around the corner. So those are my concerns.
I'm going to help you out here. We are the Monterey Salinas Transit District, and the South County services are all operated directly by MST and not by TransDev. So as far as that goes, we kicked off circulator services in the South County, replacing the on-demand services. so that we'd have regular buses every half an hour making time connections to the line 23 throughout all the South County cities. It began in 2022 with King City. This past January of 2025, 2025, yeah, we started services, circulator services in the communities of Gonzales and Soledad. And then this past May, we started services in Greenfield. Our board received a update just last week at their November board meeting on the first quarter of July through September 30th of all 4 services. And we've seen a dramatic increase in all ridership in all of the South County cities compared to previously what was being done on the on-demand service. So that's an indicator of success. We've had a doubling, more than a doubling of ridership in Soledad. That's been the biggest success story. I think it has to do with connections going to Hartnell College. Then Greenfield has the second highest ridership, followed by King City, and Gonzales has the lowest ridership. We believe that has to do with the city required us as part of this process to serve a industrial park area where there's some agricultural packing houses. There has been no ridership there at that location, and it takes us a bit of time to get out there. And as a result of that, we missed the timed connection with the line 23, which was the whole purpose of doing these circulators. We have now convinced the city that of Gonzales that we probably shouldn't be serving this industrial area. We're working with those businesses to get van pools in place for their employees. And then we'll be able to, this coming late February, I think is our next service change, or early March, we'll be modifying service in Gonzales to make that time connection, and we think we'll have increased ridership. So that's what's happening in South County. And we've also, throughout that same time period, also increased the number of MST rides clients in South County. And we can get this committee a copy of that presentation. It's actually on our website, but I can ask Ruben if you can download that and provide a copy of that presentation to the committee members. You'll get the most current information on what's going on with the rides program and MST circulator service in the South County communities. Hopefully that answers your questions.
Yes.
Sure.
Thank you.
You're welcome.
The same.
So I asked Lisa before she left, she wanted me to ask a question, not to put you on the spot, but you used an acronym that we all know, but it wasn't something that I think everyone on this AFR, what does that stand for?
Sure, PAFR and AFR, so accident frequency rate.
Okay.
and Preventable accident frequency rate.
Yeah, your slide just said AFR and then you said AFR.
Yeah,
And I just
sure.
wanted to, for those of you who,
Yeah.
if it went over your head, that's what it meant. I wanted to make sure you
Yeah,
all
good catch, thank you.
Okay.
Anything else?
Yeah, I just wanna tell you that my former employee, Mario, he loves riding the rides bus because he does it from King City to Soledad. I saw him the other day and he looked so happy, so thank you so much for hiring him. A loss for me, but I miss him tremendously because he has that character to engage and all that. I know a lot of my seniors have been riding the bus more because they called me and said, "Oh, I saw Mario today. He said hi." And I hang up on them. So thank you, but that's all.
No, thank you for that. Listen, at the end of the day, I'll everybody in this room, everybody that works for us, with us, delivers a service that we all hope will be there if we need it someday. And yeah, I'm getting to the point, all of us are with your parents, or maybe some of you are. I lost my mom a couple years ago, but dad's 85, still drives. But I'm hoping that it's there when he needs it.
Right.
And I'm hoping it's there when I need it. And it's just, it's life-changing service, and if we look at it like that, we realize what we're really doing, and we realize how important it is. So
Yep.
appreciate the feedback, thank you.
Thank you.
And I saw those eyes. He gets around like he's 70, but I worry about the 85 too. When I said 85, you're like, I don't drive with, I don't ride with him much, I drive for him.
I used to do that with my dad, like, you're driving? No.
All right. We'll move on to item 6.2, MST mobility update. Christie?
All right, good afternoon again. I'll try to be quick so we can get out of here on, well, not really on time. So to start off, I mean, in addition to the information I provided on Simply Bill 1250 earlier, in the rides program, we did do a mass mailing to all of our rides clients last month to get updated information. This is something we do every 3 to 5 years. Also within that mailing, we did notify our rides clients about the program resuming back to issuing identification cards. Since our mailing, we have now received a little over 400 forms back, which Ruben has been really great in getting that all updated within our system, along with our mobility specialists helping out. In our travel training program earlier this month, our mobility staff took a group of veterans from the new Light Fighter Village Veterans Housing in Marina to a trip riding on our bus to the aquarium. And this is part of our partnership with the aquarium, where any group that rides on our bus within our group travel training, they get to enter the aquarium for free. And then later this week, at the end, Friday, in collaboration with Hartnell College and the aquarium, a group of Hartnell students and staff will also be riding our bus, learning how to use our bus system to the aquarium through our travel training program. The taxi voucher program, our last meeting, I did mention that MST has been working on expanding the taxi voucher program out in South County, and initially we started with King City. There's been a delay in the whole onboarding of that cab company. We are still currently waiting on their response to provide their insurance liability certificate as a requirement of the MOU. And then in our Navigator volunteer program, we currently have 7 active volunteers and we have 2 pending right now. Our team will soon be starting to work on a plan for a youth navigator volunteer workshop that will take in place next year. And then in our transportation reimbursement program, we currently have 124 participants right now, and then 82 are actively submitting trips for reimbursement. So that's a quick update in our mobility programs and activities, but I'll be happy to answer any questions that you may have.
Thanks, Kristen.
Okay, thank you.
Thank you. Are there any announcements or appreciations that need to be given? Seeing none. All right. I'd like to call this meeting to adjournment. Thank you so much.
You, happy Thanksgiving, everyone. Yes.
Happy Thanksgiving.
Merry Christmas, Happy New Year.
All right. You a little better?
Yeah.
And I got one too.